Anxiety exposure therapy is not easy at all, especially if you suffer from panic attacks. Panic attacks where you fear that you're going to die, go mad, pass out, lose control. These catastrophic panics that strike us are absolutely terrifying, and unless you've experienced them, it's you can never know the terror unless you've experienced them. So what do you do if the worst happens when you're out, away from your safe space, doing exposure therapy, and panic strikes? Well, what I do is nothing at all, or I at least try to. That doesn't mean it's easy. Generally speaking, for me, symptom or sensation, a sudden symptom or sensation, like the sudden feeling that I can't breathe, or a pain in the chest, an ectopic beat or something like that, dizziness, a sudden surge of symptoms will trigger me to think, oh shit, I'm going to have a panic attack or I'm going to die, right? Now when that oh shit happens, that's the point to diffuse it and to do absolutely nothing. If you have to, stand still or find somewhere quiet to stand or sit and just wait for it to pass and then continue. You will see that if you do nothing, the panic cannot grow. Panic can only grow if we give it the fuel to do so, in the infamous words of Dr. Claire Weeks. And the only way we give it the fuel to do so is through our behaviour. If we respond to the panic, if we start to ask for reassurance or run away, try and run back towards the car or run home, speed up to get it over with quickly, to get the exposure therapy over with quickly so you can get back to your safe space as quickly as possible. These are the things that add panic to panic. These are the things that make panic grow. Dr. Weeks called it the first fear and the second fear. First fear is that first sudden pang of panic and it could be a symptom, a sensation or a thought, and that sudden oh shit, I need to do something. It's like a call to action by the threat response. It's saying to you, you need to respond to this, you need to do something about this. But the truth is you don't. So if you're doing exposure therapy and you're prone to panic, just practice doing nothing, even if you can only do it for 30 seconds at a time. And you can do this if you're in the house too and you experience panic attacks at home. You don't have to be out doing big exposure therapy. It can be just, remember, exposure therapy is exposing yourself to fear. So it can even be experiencing this intense fear at home. Give it a try. Let me know how you get on in the comments, or if you have any questions. Take care.